What's up, everybody? It's been a minute. Real Talk Chronicles is back. Happy New Year. I hope everybody's had a great year. Um, Listen, I don't even know what to tell you so much about what's happened in the past, but we're talking about the present. It's been a minute for us. It's been a minute for us, and I'm glad to be back. You know, we all had some other issues going on, especially myself. Um, but we're here, and this is Real Talk Chronicles 2026, and of course, with all that's going on and saying all of that, we got Dr. Marilyn Corder, my cuz, but your doctor, and we are back, and we're going to talk Real Talk Chronicles. Dr. Corder, how are you? Happy New Year!
Happy New Year, and we're gonna try to be happy because as the new year rolls on, so does all of this. I call it an administrative crisis. So
Mm,
we're gonna say happy, but we can try to make it happier as we stay woke.
absolutely. So you know, shout out to all the sponsors, of course, Deadly Arts and Survival Magazine, Soft Illusions Art Gallery, and Event Space. Right now, we just came off a good thing with Will Downing and Eric Roberson and a bunch of people, and it was just a lovely thing. But Doc, we're gonna get right into it. Without further ado, what is going on with all this flu, sneezing, coughing,
I'm
variants,
still
and all kind of
I'm
stuff?
still in my office. I don't know if you noticed the wall is no longer pink, it's gray. Okay,
Right,
behind me.
right.
It's it's taxing. It is devastating. Patients are sick. We have not seen the flu like this in over 2 decades. And it's the fault of the HHS head, Robert F. Kennedy Jr. He's told folks that number one, you don't have to get the flu shot. Now with the epidemic, and that's what it's about to be. It's actually a pandemic to be soon announced. Some states are just like closing down daycares, closing down urgent cares, etc., wearing masks. Now I'm sitting here, I'm wearing my mask every day. I know I've been around flu all day long. And as we doing testing, etc., influenza A. Now, some people say, well, why is it that it's so high? Well, several things. Number one is the testing that they do a year ahead or prior to the outbreak had been defunded, had been reduced, etc., so that the actual identity of the flu virus, the actual flu vaccine only covered about 30 to 40%. So should you still get the flu shot? Well, I did. Okay. And I would say there's 30 to 40% to lower your um, sick time and severity of sickness is still worth it. Because, we have some people getting flu and COVID at the same time. We have folks getting RSV, the pneumonia. So you want to make sure that you get some protection as much. I can talk homeopathic. I do that as well, but I also got a flu shot.
Understood. Oh no, please keep continue because let me tell you something.
Okay.
This is all dedicated right now to what's happening. So right now, how many types of flu are out there right now?
Well, there's flu variants, but the flu influenza A is the predominant one that we're seeing. So we get tests like you can go to your CVS, Walgreens, and get a flu test. And it's just like a COVID test, and you can identify. People have sent me videos, pictures of their flu test device turning positive. So you can pick that up. One of the things I would say, if you can avoid going to the emergency room or urgent care, try to avoid going to those places unless you're really sick from something else, because flu is everywhere. Flu is in the environment. Every time you hear something, somebody coughing, etc., 50% of those folks are flu. The other 50% would be like RSV and maybe
Mm,
even COVID. So we don't see COVID as much, but we do still see positive cases for COVID. But flu is all ages, from the toddler to the elderly. And now, usually we always talk about the seniors being the most vulnerable. We're seeing the most vulnerable cases of flu now There are two sets. There's a 25 to 35, and then there is a 35 to 50. So we're seeing higher numbers of flu cases in those age groups. And then the next would be the toddler, the younger children, and then the seniors. Usually it's just the reverse. The extremes of
Mm.
age, the elderly as well as the smaller ones, the younger ones. But everybody's getting hit. Um, and what do you do for flu? Well, there's some things over the counter, and I still recommend things like Theraflu, which has a mixture of everything from elderberry to Tylenol, and your vitamins, but also zinc, um, stay home, fluids, antipyretic, which is just a big word, the Tylenol or ibuprofen,
Okay.
making sure you're getting better versus sicker, because we have had flu deaths, 2,000, more than that so far. That was well, I think 2 weeks ago statistics, but now they're still updating, in terms of people can die from the flu, not just the elderly. We've had children, um, also succumb to the flu. So your fluids and your rest, and we treat the symptoms. Again, Tylenol, um, your, your soups. You still have to eat and drink. You have to stay hydrated. And then you just, ride it out. There's something called Tamiflu, which is a prescription that again shortens the course of the flu and the severity. And then Theraflu is over the counter. So this is not even the worst. We're going to see more flu between now and February. So whatever we saw in
Really?
the last month or two, yeah, we're still going to see flu. And if people are taking off from work, taking off from school, who was it? Just today, I get all these texts on my phone, but the teachers are taking off, and then the whole class can't come. So, they're now saying, and this is interesting, before you come back, show us a negative flu test. So that's different.
So I mean, what is this flu cause from? Is it just this time of the season, or what's happening now? Like, is it because of lack of leadership that's not telling people to prevent their health?
Well, let's start with the lack of leadership, saying it's no big deal. Um, and we all should continue to respect the flu. We've been around flu for the longest time, and people take it lightly, but they shouldn't. And they need to hand wash. They need to mask up. They need to be very aware of their body and the symptoms.
Mm-hmm.
We're seeing it. I will say this: so much lacks the medical care, um, prevention. We have really, since this new administration, have gone into a very backward, lackadaisical attitude. You don't have to get vaccines. You don't need to take flu shots. And if you're talking about something that can prevent the length of the time of the symptoms, and we don't see that happening, then you're going to see a higher number. And again, as I said, the actual testing, the vaccine shot, um, is not as effective as it would have been if it had not been for this person in charge of AJC.
Right, right, right. You know, um, I think it's just crazy how right now, people always say take the flu shots, don't take the flu shots, but when we start talking about the different variants that come out after this one, like what is this though? What How many are out here right now? Like RV, like what is it? They just
So a lot. Okay, so I'm not a virologist. I'll go there because flu is virus, but there are three or four strands, but the most common strand is influenza A. And it's interesting. My son, who lives in the Philippines, as you know, everybody in the Philippines got the flu. He was like, when I talked to them, and they got it early. When I say got it
really.
early, they got it like November. I saw them coughing. They were using a nebulizer. And I'm like, Freddie, what's going on? He said, we all got the flu, but it passed. It's like seeming like, I don't know if we're in a melting pot, but it passed faster. They didn't take. I mean, they took preventive stuff, Tylenol, Motrin, flu, the things that they know to treat in terms of, and it just passed. Even the youngest one and the oldest one. Seemingly, we have it so bad, and Stay away from the urgent care. If you don't hear me say anything else, as much, call your doctor. But I'm telling my patients, don't go to urgent care, don't go to the emergency room, because guess what else you're gonna see there? We are now, we have now declared that measles is, we are no longer, we are no longer, the statement can be made that we have eradicated measles. So there's so many cases that now we are in the measles zone. We just had a case
Mm.
at BWI. Today is on Saturday, and they tracked this person. They went to Amtrak. They were on the Amtrak, BWI, which is the airport, and one of the urgent cares. So remember, measles is the highest contagious condition, vaccine preventable illness. When you walk in the room and you have measles, let's say you walk into Starbucks or you walk wherever, that room, and then you leave, that room is contaminated for up to 4 hours, even when you're gone. So,
Really? 4 hours?
the
Wow.
airport, so they track the airport, Amtrak, all these places. So guess what's happened in the urgent care? So let's say in one instant snapshot, maybe 50 people there, especially in the airport. But you talk about, and that's a snapshot of at that moment. But think about how many people pass through that area, up to 4 hours. And then from there, they going into their designated places, home, work, school, go see their loved ones, and they are contagious and don't know it, because the symptoms may take up to 10 days. So that could be a major spread.
Mm.
And especially the folks who didn't get a measles shot, which are your babies. And now there are other people who didn't have their measles shot. I had a call today, and you know, and I'm not trying to overwhelm you with shots. All right, I'm not that doctor, but I know measles kills, and I know measles gives you encephalitis. So the point is, which is brain. If you're not dead, your brain is gone. So it's a rash that most doctors, well, hopefully they will, but a lot of doctors have never seen the measles, because 40 years out, we've had the protection. So my fear is measles sitting in, we have an ER, urgent care, sitting next to all the people who are sick already, and the doctors or the staff don't know to bring that patient back, isolate, and contaminate. I mean, and decontaminate as much as they can. Um,
Mm.
so we're seeing measles. So watch the numbers; they're going up. We're seeing increase in flu, um, and we have RSV, respiratory syncytial virus. 2 years ago, that was like the big bad wolf, RSV, and that's
Mhm.
because we had just come out of being being home from COVID, so everybody's immune system was down. So we're still going to see some RSV, because that's old. RSV has been around 50 years, 60 years, but now we're not so vulnerable to RSV. So there
Right.
we are. Now we can talk a little bit more, if you want to ask a question on measles, but we can talk a little bit more on what's happening as of January 1st to the health system.
Mm-hmm. Please continue. Yeah. Uh-huh.
I don't know how many of your listeners have actually called to their provider, uh, their medical provider, be it Humana, Aetna, Cigna, um, or have opened their mail, and the mail says, make a phone call. You don't, your coverage is no longer that, or call to update your coverage. And folks have called me and said, Dr. Corder, I don't have the same plan I had before, because now it's costing twice as much, and twice as much in a family plan may be up to $2,000 to $3,000. That's a house note.
Mm.
That's a rent, and so some people just can't do it. So the doctors, a lot of the doctors are like, well, we're not going to schedule you, Miss Jones, until we verify that your new insurance covers the things that we do in the office. So people are paying out of pocket, even when they go into the pharmacy, which may have been just paying $5, or a copay or nothing. Don't be surprised when you go, you may end up having to come up with $50 for that prescription that you didn't have to pay for before.
Yeah, I mean, without getting you in trouble, what's your thoughts on this whole changing? getting rid of Obamacare and what is it? What does it call it? The friendly bill?
Affordable Care Act.
Yeah, the Affordable Care Act. Yes.
You know, there was a vote the other day
All right. I don't know if we lost you or you. Uh, did you freeze up? Everybody, this is Real Talk Chronicles. I'm your host, Bill Forster. That is Dr. Marilyn Corder, my co-host. We're back, 2026. Happy New Year to you all. We will be here Wednesday. This is the podcast that keeps it real. Hey, listen, I don't know what to tell you about this flu. I think you just should all take whatever it is that you do to help prevent or keep your immune system intact. Doctors dropping jewels. We will be here Wednesday as Stefania called the cop crew. So I look forward to having my boys back, and we're conversing with you all, talking about this and that and anything. We'll talk about Monday. He just did something for child care, 2 years old and under. You can, it's supposed to be free. We can also talk about the young lady that got killed by the ICE agents. And Malika. Yes. So
Okay.
There's so many things that we really want to talk about in regards to, do you feel about the ICE jumping in Venezuela? You like what the president is doing? There are some people I know that, listen, he could throw mud in their mother's face and they understand why. I personally do not. We could talk about Stephen A. Smith coming under fire, talking a lot about Jasmine Crockett, Joyce Reed. What are y'all thinking about Stephen A. Smith? Has he kind of overstepped his boundaries on what he's saying and what he's doing? I get it. His pockets is fat right now, but what is actually happening? Are you co-signing what he's doing? How do you feel about what he's saying and stuff like that? Hold on for 1 second. Oh, okay. My wife is going to do what she does.
You can keep talking.
Oh, okay. Yeah, so there's a lot of things when we talk about these ICE agents that I personally don't have a lot of respect for. I don't have a lot of respect for them because, of course, I remember when I went through law enforcement, the training was 6 months. I do not think that they're doing 6 months of training. So I think these guys are like Proud Boys that are getting 8 weeks of training and then letting them go out there and do their fake Patriots style of work. But we got Dr. Corder back. I'll get back on that Wednesday. No, that's all good. I was just giving us some insight on these
the
ICE ages and things of that magnitude. So I got my feeling at that, and I think Wednesday I'm gonna go off a little bit. Well, I'm going to talk about Stephen A. Smith and what he's doing. He's coming under fire. I'm going to talk about Madani. A lot of people are mad at him with the socialist title, but how many rich people are living off socialist ideology? And I was talking to somebody recently, not to deviate so much from what we're talking about, because I know you and I can go all over the place. But I was talking to somebody and he was like, "Oh, what do you think about Mandani?" And I was like, "What do you want me to think about him?" He was like, "Oh, he's a socialist." I said, "Well, our military is built off of socialist ideology."
Mm-hmm.
He was like, "Well, wait a minute, but that's different." I said, "Why is it different?" Because you accept that aspect of the social ideology, because it's the military, you're America, the red, white, and blue, so it's okay. Now I'm no way saying that the military shouldn't be free. Just saying, if this
Mm-hmm.
man has an idea of how to make a lot of things affordable or free, why are you knocking his hustle?
Right.
But but it's a whole nother energy and atmosphere with that. Um uh what's up, Malcolm? He said I was told, let me see. Let me see if I still can share this. Yeah, I'll show it. You know, he said, what is this? I was told today Orange Man wants a fire fight between civilians and ICE so he can call martial law. That might be true. This will put all elections. Oh, yes.
Oh no,
Yep.
yeah.
Yeah.
Wow.
Because you know what's so funny? I've heard that too. If he puts all the elections on hold, then
Mm.
he
Would
has to
be
stay the
still
current president. Listen, there are some people cuz that I've lost so much respect for because they love this dude. And for the life of me, I can't see it. And why don't you see uh what's the big picture, oil and stuff like that? We could talk
mm,
about Obama, we could talk about anybody else that put bounties on his head, Biden, anything like that. But when do you go into somebody's state in a house and kidnap them and take them out and bring them over to your part of town and buy them? You know what I'm saying? So it's gone too far. People love them, you know, especially uh, and I'm just
ignorant
going to give you
people.
my opinion from the law enforcement standpoint of shooting at a vehicle.
Oh yeah.
That was never a practice
Hmm.
in my tenure in my professional life. Uh, if you slow it down, you can see that he pulled his gun before she even started coming at him,
I know. I
and then
know.
you want to shoot 3 times, and then if you notice, after he shot and she stopped from I guess the trauma to the center mass or wherever she was shot at, he was walking like
He was
somebody like
fine.
yeah,
Exactly. Exactly. And then they whisked him away. He was walking fine and calling her a F and B.
exactly. He was walking towards like his coworkers like to say, "Yo, order me a turkey and Swiss,
Right.
you know,
Right. Right.
hold the
Right.
mayo." You know, like
Right.
it
Right.
wasn't anything in this thing. Um, there's so much going on, which is so crazy right now. Uh, the energy. There's just
So they're recruiting and they're giving them tons of money to sign up, thousands of dollars, and if you recruit somebody else, and they're trying to give them 50,000, 100,000, just and it's we know who it is. It's white supremacists signing up. It is the MAGA. It is the folks who feel that the rioters. So
yeah,
and your friend may be right. He wants to cause a uh, riot, disorder for martial law. He'll do
hmm
anything. He'll do anything. Venezuela, the the drugs that he said are coming over here are nowhere near the drugs that for the country that the man that he just gave a pardon to. It's not about that.
exactly.
It's about the oil. You have to follow the money. You have to see. And Exxon said, wait a minute. I'm not going to invest. It looks a little shaky. It doesn't seem to be stable. So what did he do? He dogged Exxon. He just said he don't know what he's
Yeah,
talking about. It's like if you don't agree, if you're not going to yes up to him, then I don't like you. You're not my friend anymore. And I'm gonna dog you down. And people just don't see it. Several other folks who was drinking the Kool-Aid, they understand now that Kool-Aid is tasting mighty bitter.
bless
Mighty
you. Yeah,
bitter. Bless you.
yeah,
So
yeah. It's so funny. Like I look at a lot of people, and it tells me a lot about themselves. I was having a soccer former a good friend. I'll call him a good friend, and a former law enforcement guy, and he was talking about how there was a problem. Look at how they poked the bear, this and that situation. So I said, Joe, I said, listen. Oh, sorry, I revealed him.
mhm.
I said, wonder if that was your sister. I said, because right now this is a white woman.
A
right? Like,
citizen.
yeah, a citizen, a white woman.
Right.
So then they
Right.
was, and then listen, I'll tell the president, I'll tell the vice president, I'll say it to their face, I'll say it on the social media, I'll say it in a journalistic way. I don't know if you have been in that kind of situation, but if you look at the trajectory of the car when she was pulling off, if she was trying to hit him when he shot her, she would have went straight. She
That's
would have not
right.
kept.
She was
She
trying to
would have
get out
not.
of the way.
She was trying to get out the way.
Yeah.
Either elude, evade, whatever
Right.
adjective you
Right.
want to use. She was trying to get away. I do not understand the ideology of where America is at today, where it's just like, yo, he's right and you're wrong. It makes no sense to me. I'm sickened by it because the bottom line is what happened to just decency. Now, did you hear what he wants to do reparations for white people? Did you hear that? I posted that recently. Uh,
Say that again. He wants to do what?
reparations for white people.
So were they enslaved? What's up with that?
He feels that they've been treated unjust after the what was it, the Civil War that I posted or something?
Oh yes, I heard. Yes, 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 yes. Oh my God. Oh my
Listen,
God.
I don't know what's next. I hope he leaves the medical alone. Pretty soon, you know, you might have to get asked. You know what's so funny? I was telling Malika, is like the craziest thing is we're not from approach right now.
I know. I
Like
know.
I call these guys out here right now. I was talking to a guy. He was like, "Yeah, they're covering their face because their families are being threatened." I said, "Yo, Joe," I said, we worked every day and our faces were shown,
Mm-hmm.
but
Mm-hmm.
our families weren't being threatened. We were threatened. What are you
They
talking
were.
about?
Yeah, because police off. Yes. Right.
Like the
Right.
reason why these guys' families are probably threatened is because they're looking at it like, Jimmy, you was just working in Walmart, and
Right.
now all of a sudden you 6 weeks later you're an ICE agent.
Mm-hmm.
We don't even know
Mm-hmm.
if these guys have felonies.
That's right.
We don't know anything about them.
Mental.
But
So how about this? The guy that killed and murdered the woman, Renee Good,
yes,
he had been, was less than 6 months ago, he was trying to stop somebody and they dragged him. And he
yep,
had so many stitches and they showed his arm and his leg. Why was he still out there, quote unquote, policing? That's PTS. He should
yep,
never have been out there because even if, I mean, she was trying to get away. And I can't blame her. They were telling her, get the F out the car. There's no telling what they were going to do to her. So she was
listen,
running, she was fleeing for her life, for her safety, trying to get away. And meantime, he's jumping and faking that he's getting hit for the car and shooting her. He was reliving that trauma of months ago. He should never have been on the front line, ever, psychologically, ever. And they need to sue her wife needs to sue the pants off of Trump, off of this administration, because that's wrongful death all the way around. Just
absolutely, absolutely. When my thing is, when do you so so we're going to talk about trauma and what, like you said, what he experienced, right? How did he
mhm.
get back out there so soon?
Right. Right. It's like the good old boy. It's like, okay, I'm just gonna come in and 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 take it out on everybody
Yep.
because of what happened. I had gotten dragged. He shouldn't. The when you hear about how he got dragged, that was his fault too. That was
Yeah,
his
yeah,
fault.
yeah,
So
yeah.
I'm
Because
like,
I don't get it. I'm going to really delve in deep on Wednesday. I'm gonna
mm-hmm,
go hard because the bottom line is it is disgusting to me. It's a lack of moral compass, like how people can view and see things the way they see them without any humanity and humility in this world. And what is showing me is that so many people of Caucasian descent, uh, Latin descent, or even African Americans, if you're rocking with that side, you co-sign that.
mm-hmm,
And
mm-hmm.
that lies the problem for me, because the bottom line is, when people always say don't make it personal, how can it not be personal?
Right. We all
That could be
one,
me. That could
right?
be
One
you.
ring.
You know.
That's right. That's correct. That's correct.
I mean, this is a woman. So you felt that you had to shoot a woman. I would have rather.
Unarmed. She was like, "What's up, dude? I'm okay." She was pleasant. She was not hostile. She was not
What a dog
threatening
in the back seat.
with a doggy in the back seat. She was a soccer mom. Come on. Yep.
You mean you telling me I would have respected you calling her all kind of LGBT things, effers, hoes, everything. I would have respected that. I'd
Hmm.
have respected you throwing a snowball at her or something. But you shooting at her like,
Right. Right.
and then now we want to justify that you got PTSD because you got hit before. Then
Right.
you need to be working somewhere else, kid, and
That's right.
at a
It's,
movie
it's
theater passing out popcorn or taking tickets. I don't know what to tell you.
or a padded room.
Absolutely. Everybody, Real Talk Chronicles. This is Dr. Marilyn Corder. I'm your host, Bill Foster, too. We are here. This is the beginning of the year for us. We just wanted to talk about this flu stuff. So, of course, we got a couple of minutes. I mean, we got 20 minutes, but I don't want to overhold you because I know you are working overtime. So when people are coming to see you, Doc, your patients, are there different levels of flu? Like, do you know, okay, this is flu A, B, C, D by the symptoms? What are the symptoms? Aches,
so
pain?
so
Like, what's that?
so so first is a sniffle, and you may have a headache, and you could have a flu that's aggravating your digestive tract, what we call, even though norovirus is going around vomiting, diarrhea, but with the flu, you can have some symptoms of your digestive tract. But the main thing about
Mhm.
flu, as one of my 6-year-old patients said the other day, he said, "I just couldn't get out the bed. Their whole body is
Mm.
is heavy and painful, and the headache, the neurological part of the flu, the headache, you're dragging, you have fever, you're coughing. I say 50-50. Some people don't cough, but some people do. So I call it not so much the type. I say if it's, you know, early, middle, or late flu. Now, the problem with late flu, if you have had that cough, and we're talking about going into 7 to 10 days, please get checked, talk to your doctor on telehealth, because with all the mucus and all the inflammation that flu brings, you can then also have a setup for a bacterial infection like pneumonia. It's like the mucus is sitting there, an ideal situation for a bacteria to begin to grow in your lungs. So it's not unusual with someone who have had the flu and they just couldn't kick it, and they continue to have fever and they're getting sicker and sicker. Our cousin, I won't mention her name, but our cousin that happened to, and we
Mm.
were at a brunch right before Christmas that Sunday, and we were sitting next to each other. She thought she was fine.
All right. I think we lost it. We're going to get back. Everybody, this is Real Talk Chronicles. I'm host Bill
Can you hear
Force.
me?
Yeah, we got you back. Go ahead.
Okay. When my phone rings, it does that. But the next day
Absolutely.
she said she had the flu. Okay, and
Mm.
she was sick for 3 weeks, just now coming. So she ended up getting pneumonia.
Wow. So, Doc, I'm glad you mentioned pneumonia. Explain to people what's the difference between flu and pneumonia.
Well, one is viral, which is the flu, and one is bacteria. The problem with the viral, you get past that. I mean, you can have the prescription for the Tamiflu, which shortens the flu symptoms, or you can go ahead and get some Theraflu and other things, rest fluid, Tylenol, and aromatherapy, all of those holistic things. With pneumonia, you need an antibiotic. Okay, it's not
Okay.
going to fade away, so that's the difference. But again, you see people, a large percentage of folks who have the flu are unfortunately a setup for pneumonia.
Mm.
So this is where you need to understand what is happening to your body. You need to understand what you may end up needing beyond antiviral medications.
Okay. So, I mean, is can the flu kill you? I know we already heard about
Yes,
pneumonia can kill you. Okay,
uh,
please.
the flu can kill you. If you
Okay.
listen, the flu causes respiratory distress. The flu causes severe fever, neurological. The flu can kill you. And people have died from the flu. And people are not always going to be elderly folks dying from the flu because it attacks your whole body. And that's why, again, hand washing, putting your mask on, take it seriously. Usually it goes away a good 30, 40%, but there's some people, 10 to 15%, they can't get past it. So they have to be hospitalized with fluids, with medication, antiviral, and which is anti-flu medication, and observation, sometimes oxygen. They
Um,
may not catch their breath. They may be to the point where the flu is overwhelming their whole respiratory tract.
what about if people have other underlying
Right. Well, there you go. So we call it other conditions. We call it comorbidities, where they have other conditions such as asthma, such as COPD, such as diabetes, such as congestive heart failure, and here they come getting the flu comes through, and the flu is there, and their conditions then go to the 10th level in addition to the flu.
mm,
So
and that means their immune system is compromised.
compromise. Yeah,
Yes.
yes. So they will get it. We fight back viruses. That's why we talk about building your immune system, vitamin C, zinc, vitamin D, fluids. So you're fighting your immune system is trying to fight against the flu because it's a virus. But if you have those other conditions and you're taking medications that also aggravate your immune system, then you are, I hate to use the word a sitting duck, but you're gonna get sicker than most people
Hmm.
when you have the
Hmm.
flu. And that's where you have to make sure. You've had people go to sleep and don't wake up. And all they think, other
Mm.
people say, oh, they just had the flu. Well, it was beginning to overwhelm them. So check on your loved ones. We families are all over the place, and you know, they may not have called this person or that person, but lots of people are doing welfare checks and in
Mhm.
places, and with the grandparents, with the godparents, or whomever, their neighbors. I have a staff member who, her next door neighbor, she lives in an apartment here in DC. Her next door neighbor had been dead for 2 days.
Really?
She said she went over there. She said, I started, she called the she called the paramedic, and they said start CPR, but she said, Doc, that she was stiff. They telling me start, say, she's like,
Eh,
that's not
Listen,
gonna help her. But if you say to do it until you get here, but she said I knew she was gone. So you just check on your folks.
yeah. That trust me, I've been in enough DOAs. If it's
Yeah,
stiff, ain't
yeah,
nothing. If
right.
that's just saying I
It
did
is
it.
what it is. That's right.
Yeah,
It's
exactly.
gone. You are
Exactly.
gone. And
Because
maybe perhaps 2 days prior, if someone had called or check on you, may be upset with somebody, but just give them a welfare call because that
yeah,
might be a
well,
life
yeah,
you
wellness
saved.
check. Yeah, yeah. I think that's a big point too, to say that listen, let's check on the elderly. Let's check on the regular Jane and John Does of our
Right.
lives because there isn't
Give
anyone
them a
that's not
call.
exempt from death. Death,
Right.
death doesn't care how old you are, and he don't care how young you are. He'll come and
That's right.
snatch you and
That's
take your
right.
little derriere right out of here just because. So we definitely need we definitely need to make sure that we look in on it. So what would you say would be some of the preventive things that a person should do besides I know of course washing our hands, but give us some examples of things that you think are just
Well,
preventive things to do.
and,
Okay.
and I wish I had stock. I tell folks, get your vitamin C, get your lozenges that has zinc, but also get everybody should have those vitamin C packets that is it with emergency, and you can put that in water. It could be a warm beverage or a cold beverage, but that gives you 1,000 milligrams of vitamin C, and that helps you
Mm.
fight flu and other viruses. I say go ahead and get some Theraflu. Some places are running out of the Theraflu because people understand, but you want to have it ahead of time. Have it already in your cupboard when you're coming down with a sniffle. Your
Just
coworker
ready.
coughed on you.
Ready.
Have it ready, right? Coworker may have coughed on you, etc. When you don't feel well, call in. I know I'm on the workforce, but call in and just say don't feel well, because if you come in and then infect everybody else, I make sure my staff is masked. Don't come in here sick, because we got sick in here already. So get your mask on. I had to tell one today. And our patients are so cute. They're so cute, but they're weapons of mass destruction. They coughing. They look at you and just charming, but they'll cough on you, get too close. So so I'm like, okay, put your mask on. Johnny is cute as he could be. Yeah, look at him smiling at you, but he gonna make you sick. He gonna he gonna look at
Yeah.
you with those eyes, and then next thing you know, he gonna be snotting all over you, and it's done. And then you're gonna be
Yeah.
out for a week. So
Let me
take
tell you
these
something. If
pictures.
I could be a fly on the wall, I know Doris Jean came right out of you in a minute.
Okay, that's right. That's right. And you know what's funny? I go into the doorway. I got my mask, I got my glove, and I see my staff. Oh, da, da, da. I say, and I'm not gonna say her name. Let's say her name is Sally. I'm say, Sally. I do like this. What out of here? And I say, and I point. I said, here's the box of masks. She said, oh, that's right. Oh, that's right. I said, because you're gonna be calling in the next day or two, and that's
Yeah,
gonna
yeah.
affect all of us.
That's gonna because it's gonna put us all on
Okay,
alert.
I work hard as it is. I don't need to work your front desk and your and the back and all that.
Yeah,
So
let me do what I do. I'm the doctor. Let me do doctor stuff.
yes,
Right.
get on out
Yeah.
here. This is not
Right.
a. They didn't come see you. It's not a social event. Okay, okay. It's just go on out. You got her in the room. Go on out because you don't know how to mask yourself.
Yeah. Let me tell you a story real quick. It's so funny. And Malika knows the story ain't true. My slogan: a story ain't true unless somebody co-sign it. So I went to the doctor's office, and I'll leave it like what doctor it was or wasn't.
Right.
So the bottom line is they wanted me to come in. It was the dentist. I don't care. Ain't nobody kicking my
Uh-huh.
behind. It was the dentist. So the receptionist slash whatever other duty she had, she was like, come in, whatever. So I said, well, something about whatever the fee was. I was like, well, I'm not coming in. So they was like, wait a minute, you can't do that. We've allotted this time for you, like da 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 da. And you can't, you got to cancel within 48 hours. So I said, well, how many hours is it now? It's 3 days. So I said, I'm canceling. So she kept going on. She kind of went on a little tyrant. So I showed Malika the thing. I said, before I go B, I said, am I reading too much into this? So she was like, nah, she a little over the top. So of course, when I go to the doctor's office, I said, listen, I said, I got to express my feelings to you. I said, I thought you was really over the top. I said, you was doing this. She said, well, no, I did. I said, well, wait a minute. I said, you're a receptionist. Do receptionist shit. I said, yo, you know what I'm saying? Like, yo.
Instead of that terrorist talk.
Yeah. I said, I understand who you was talking to, because I said, you're not going to ever tell me what I can do and can't do. Your job is to tell me what time I'm supposed to come in,
Right.
what's my copay, or what I not supposed to pay, or what I can't pay. But to tell me, yo, you supposed to be here, and we did this. I said, yo, you was over the top, and I ended up telling the doctor, yo, she was off the top, and I said, listen, you had to check her, because I did, because I said I couldn't believe that a receptionist lady talking to me like that. Like I said, you don't even talk to me like that, doc. I said, how's she gonna come out of pocket? So the moral of the story is, like I said, for anybody out there that's working in the doctor's office, cover up so my cousin or any other doctor don't have to do their job, do your job too. I don't have to hear it. That's how I'm gonna spin that. The moral of the story is just cover up. Do you think people should just start wearing masks again? Period.
They're gonna have to. Matter of fact, it may be mandated in another couple of days. They're gonna need to. And I'm like, okay. You see some countries, they never take the mask off, but we got to put our mask back on for self-preservation. And then when so the hospitals, when you go in a hospital, you have to wear a mask.
Okay.
So that's where it starts. When you visiting your loved ones, etc., they don't know what you're bringing in on that floor. The nursing home. So eventually it's going to be back in the daycare, in the schools. It will be back, and it's for your own protection. So I be wearing my mask, and if I have to do an errand in the middle of the day, I still have my mask on. I may go to the post office, go down to the bank, and I I'm driving with my mask. I used to look at people. I'm like, why do they have that mask on? They're in the car by themselves. But
I
it's like,
know.
I got my mask on. I told Fred, my husband, he said, why you got, I said, oh, my nose is cold. Leave me alone. So I'll have a mask on. Okay.
Yo, it's so funny you said that because anybody out there that drives or anywhere, and you'll see somebody in the car and they got
Right.
their mask. Like, you be like,
But
that's a little
what
stupid,
the hell
silly
is that
person.
about? Right.
You know
Right.
what I
Right.
mean?
Right. Right.
Like, what you afraid of your own
Right.
bacteria or something
Right.
like
Yeah.
that?
Isn't that stupid? And then I'm doing it. Okay.
But you know what's so funny? That's the thing now that you're right now. It's like almost having your earphones and the AirPods or
Right.
something like
Right.
that.
It's like
Right?
it's like your
Forget to
it's
take them
like
out
your
when you get in the car.
it's like your apparel. It's like, okay,
Yeah.
got my mask on.
Listen, rather to be safe than sorry, because what's so funny? What's out here in the air, and you can tell me if I'm wrong or right. I guess it travels.
I
Whatever's
just
out there
told
in the universe.
I just told you, measles is in the air. If you've been in that place where that child was 2 days ago at the airport, after this, so you don't have to have somebody coughing on you. You don't know if a person with measles was there an hour ago. Put your mask on.
Listen, Malika, you hear that? We're gonna have to get our masks.
That's right. Put your mask
Yeah.
on. Put
And
your mask
we
on.
got you can't tell us anything. We think we fly. We got masks with different colors. So
Yeah, with
we
accessories. Oh, I got some cute masks. Christmas time, I had masks. Valentine's coming up. I got the little mask with the heart. You can be cute. Be cute, but be safe.
Yes, yeah, exactly. There's no way in hell. I'm gonna work it out. Listen. My mask going to match my outfits.
That's right. That's
Because
right.
I'd rather be safe than sorry. And for individuals, you heard the doctor earlier talking about the immune system is low. It can be compromised. Besides staying home,
Mm-hmm.
please, like you said, start wearing your mask again. I saw a lady that I know, my neighbor. She was walking with a mask. She had a mask on while she was walking the door. She didn't want to catch any of that draft.
That's
Like
right.
that. She didn't want any
That's right.
any of that forbidden air.
And then when somebody touches a doorknob and they have snotted on their hands or whatever, those germs on
Yeah,
that doorknob will stay for a while. Take a tissue before you touch the doorknob, paper towel, and turn
absolutely.
it. But I'm telling you, it's it's real. We wipe down the furnitures, we wipe down the beds. My exam room, we wipe down because we know,
Yeah.
and everybody else needs to know. And then when they say, "Oh, that's not going to bother me," again, I'm sitting there. I take immune boost. I take so I take CBD immune boost. That's, yeah. Let me put it out there, okay?
Mm.
And that's why when I was sitting with my cousin without a mask because it was brunch, I didn't get sick. That was a Sunday. The next day, Monday, I had an engagement to go to, and that was Monday at 7 o'clock. We get home, and my friend who we were hanging out, she calls me the next day, Tuesday morning, and says she tested positive for COVID. I had been with influenza A on Sunday, COVID Sally on Monday. I tested for both. I'm negative because my immune system. I wasn't wearing a mask. No, but my immune system is tight. I'm not playing. I'm not playing. I'm not playing.
But
So
funny. It's so funny that you mentioned COVID. People forgot about COVID.
yes, 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 yes. I know.
COVID is the new coal, right?
I know. It's
Like
like whatever. Oh yeah, that's just COVID because COVID's still around. But it's like, okay, right, right.
I listen. I would hate to see when you go to your conferences or your refresher courses or whatever it is that you do, or just your own research, and you see the list of things that people are getting sick from,
Hmm.
and all the different flus and the covids and
Yeah.
this and that, and so many different things. Doc, before we get out of here, tell
And look,
people
and
what's
look,
the
that's
pop.
why, listen, that's why some doctors are dropping the mic. They're like, the hell with it. And they're going home. But go
Yeah.
ahead. Quite a
No,
few.
no, no. I get it. You got to drop the mic sometimes.
Right. So,
Tell people the proper way to cleanse their hands, to wash their hands before
soap,
and after they go
soap,
somewhere.
soap. Let me tell you, we got all this hand sanitizer. Get some soap and scrub your hands for 2 minutes. Act like you haven't. I mean, some people say that's excessive. It's not. It is not. And the hand sanitizer is a little bit, but you still got the germs, and they surface through. Suds your hands up. Teach your children. Get your tissue if you have to sneeze. You know, we say cough in your arm, but hopefully you're coughing away from somebody. And then if it's in your arm, wipe your arm. But you have to make sure that you're hand washing. Of course, in the
Mm,
medical field, we keep gloves on. You know, and we have masks on, but you're not going to do that. But definitely have your tissues. Tell your children not to drink after each other. I had
mm.
one. I had my cousin on my daddy's side come in today. She called me and said her daughter's best friend got strep, and now Evelyn's having a situation with her throat. And so she comes in, and I treated everybody. I'm like, you know what? Y'all not gonna get sick, the whole family. But Evelyn has strep. You know, so it's like you got to be extra extra careful and super duper preventable. It is your body, and your doctor may be retired, or you can't even get to see them, and then they'll tell you to go to urgent care or the emergency room, and that's a petri of infections. Every other chair has something contaminable. Every
Because yeah,
they
urgent care, they're not wiping down chairs and stuff like
no,
that.
no, no, your butt getting up, somebody else sitting down. You can't shoot. They in line waiting for your chair. Okay,
Yeah,
and they gonna
yeah,
sit there. They go. It's like the cartoon Peanuts. The little kid that had all that cloud around her. Every chair has a
yeah,
cloud of whatever,
yeah,
and you sitting right in the midst. And
yeah.
lo and
Because
behold,
let me tell you something.
yeah.
I think I'm going to speak my own personal. I think urgent care is a great like segue to the doctor or the hospital, but I can see where the urgent care has not been spot on. Let me just say it like that. They
Oh,
have
I
not been.
know that. Somebody told me. Look, one of my patients sent me a picture, and the boy. And so I said, "Well, Lord, that may be precept or septal or cellulitis."
Mhm. Yeah.
She went to the urgent care that could look right in the eye, and they said it was a allergic reaction. The child got sicker that next day. We went to the emergency room, and it was what I said it was. She said, "Well, you need to be working in urgent care." I said, "Oh no, I don't." I said, "But I need to be training doctors, more
How about
doctors."
that? That part right there. Yeah.
Okay,
Yeah. Put me in front of the podium, not
okay.
in urgent care. Don't minimize my skill set and then put me
And
in urgent care.
my old eyeballs with my old phone. I don't have all the tech. I knew what it was. I knew. So she goes to
Wow.
urgent care and they tell her, oh, it's just an allergic reaction. Oh, I don't think so. That thing was out there. I said, oh no, that's got to go to the emergency room. I mean, that's called the hospital. And they had the
Yeah.
baby on the
Yeah.
IV. I said,
Yeah.
uh-huh. She said, it's just what you said, because you can follow the text. So
Mm.
the day before I told her what it was, and then she went and they told her something else. They was giving the Benadryl, wasn't working. I said, no, it's not going to work. The child needs an antibiotic. She said, well, you were right on. You were spot on, and you did it from your phone. And they went to urgent care, was all in the face, looking at the child, and didn't know how to diagnose. So I'm going to say that's it. So hopefully your doctor's still in practice and know, and know what to look for. And then you have to
Yeah.
make sure you watch out for yourself. Make sure you begin to be vigilant for your own butt, because you have to preserve, you have to make sure that you know what's different about your body. Whatever, if the cough and cold is still going on 2 or 3 weeks, make sure it's not pneumonia. Make sure you checking the temperature. And then generally, if you got diabetes and hot hypertension, I lost more friends in 2025 than I thought. I mean, not just cancer, but illnesses that they just didn't follow up on. And these are educated folks, but they just got busy. So we have this
Absolutely.
2026. We need to self-preserve.
Yeah. Yeah. Listen, it's better to stay away than to go and get sick from. You know
Right.
what I mean?
That's
I
right.
tell you, person, listen, we might be getting back to the days of Zoom calls and
That's right.
birthday celebrations via
That's right.
Zoom and stuff like that.
And just
I mean,
send a card and say you love them. Okay.
yeah, send them an Amazon card or something.
That's right. That's right. Just think of me
$50.
when you go out and get it. Right. Exactly.
Yeah, and I'm going to say it, whether you can say it or not. The health person in charge, he's not making it any better. So I mean, you know, when I talk
But he's
about
crazy. He got worms in his head. He's crazy. And he's been on drugs. He is crazy. Okay, who are we listening to with that? Shit.
yo,
Just like the orange man. We gotta follow our own. we we need to understand we have more common sense than both of them combined.
yeah, yeah. You know what's so funny when they talk? You know how a dog will hear a strange sound and they tilt their head to the side.
Yes,
That's,
yes.
that's how I feel sometimes. I'm like,
But I know. I'm like, did they say that? Did they say Tylenol causes autism? Come on. And and not to mention he couldn't pronounce acetaminophen. I got 3-year-old, 4-year-old patients telling me acetaminophen. I see
yo,
man, I said man, I'm like, what the hell is he saying? Oh,
yo, that's your man. That's when I tell people. I say, yeah, he mixing up his vowels and consonants. He just tearing shit up. He
I,
don't know what he doing.
and
Doc, so,
mad
go
because
ahead.
he couldn't get in college. The colleges mad at the universities that said no to him, that said no to his child. So I'm like, you know what? People
Well, we
work too
know why
hard,
now. Because you
huh?
silly. We
I
know why
know.
they said no. And they should have said no. They
And
didn't
his
want you in
father
there.
bought his degree. Right, exactly.
Yeah,
Look at what happened. Look at the brain we're talking about.
yeah, yeah. He's not unbelievable. Doc, give us some positive affirmation. It's good to see you. We'll be back next month. You know, we're gonna definitely yeah, I mean, listen, I look forward to this, even though I get it in with my guys, but you know,
Hmm.
health, health is wealth.
That's right. And no
Let me
matter
tell you
how
something.
much money, if you get so sick, you can't buy your way out. So let's stay basic. Let's have your common sense, because if you're led by the person that doesn't have common sense, then and you believe that, then you're doomed. So let's go old
Yeah,
school. We can do this. We as a people, we understand. And what we
yeah,
can do is begin to understand our health. Like you say, health is our wealth, and we need to get wealthier and we need to be aware. So stay
yeah.
woke and make sure you use soap, not just a hand set, soap, tissues, and avoid those who are sick so they won't give it to you. To spread love and not spread germs.
Exactly. Listen, that's Dr. Corder. Malika will be calling you. She's gonna call you about something else. But
Okay.
listen, everybody, that's Dr. Marilyn Corder. I'm Bill Foster. This is the first one back. Listen,
I'm
it's
excited.
knowledge.
Thank you.
Exactly.
I was looking forward to it. Now I can go home. I was looking for. I said I'm gonna sit in his office because sometimes the reception in my country house ain't good. I'm like, that's not a good look for the first one. I'm sorry. Early my computer, I
Exactly.
think I kicked something under the floor, so I got on my phone.
That's
But
all right. You my
I'm
cousin. You my
keep
older cousin. You can kick something up. Oh, and another thing too. I might be bringing our cousin in on some such segments.
okay.
Dr. Selma, you know,
Okay.
and see
Oh yes.
and touch her expertise on some things. You know
Oh
what I'm
yes.
saying?
She and I
Why
have
not keep
lots
it
of
in
things to
family?
talk about.
Yeah,
Absolutely.
absolutely. All right. I
Okay.
love you. Get home safe.
All right. Take care. Love you guys.
Love
Bye.
you. Bye bye.
All right. Bye
Everybody, that's Dr.
bye.
Marilyn Corder. We chopping it up. This is the first segment of Real Talk Chronicles. And we're in here and we just talking about a lot of things. We had a little technical difficulty, but it's all right. There she is. She's back. She's coming back to say hi. Bye.
Technical difficulty. I can't even hang up.
Well, I'm going to log us out right now. How about that?
Okay.
Everybody,
Thank
good
you.
night. I'll see y'all
Good
later.
night.
All right. Good night.
See you later.
Bye. That was hilarious. She said she couldn't even hang up. I don't think I can hang up. Top right corner. It says end stream, but it's not ending it.